Wait on him. Whenever you're ready, Chairman.
Okay, good morning, everybody. Welcome to the May 25th staff meeting for the Sedgwick County Commission's office and staff. So welcome, Tom Stoltz.
Thank you, Chairman. Good morning, Commission. Just one item today to talk about. Tanya Cole is going to update the Commission regarding a conversation we had with Judge Gehring and Ellen House on Friday regarding some guidance from the state Supreme Court on COVID protocol inside of courtrooms. So we have an update on that, and we can talk about it when she's done.
Morning, Chairman and Commissioners.
Good morning, Tanya.
How are you this morning?
Fine, thank
Good.
you. Thanks for being here.
So last Friday, Manager Tom Stoltz and I attended a meeting with Chief Judge Gehring, Ellen House, and Local Health Officer Dr. Gerald Menz. And the meeting was in anticipation of an administrative order that was to come out from the Kansas Supreme Court, which actually came out late last night, to give flexibility and favor local control as it relates to masking and social distancing within the courtrooms and courthouses within the judicial districts. And the administrative order is requested that it be consistent with CDC and KDHE recommendations, and that it work with the assistance of the local public health officer. And so Judge Gehring and Dr. Gerald Menz worked with us and asked us, the county, to help them through kind of working through a phase-out approach in helping with the masking and the social distancing within the courthouse and within the courtrooms. And so what they would like to do is, again, this phase-out approach and modifications. And so starting July 6th, within the courthouse and within the courtrooms, starting at the entry point of the courthouse, they would like to continue the live screening. And so what that means is the courthouse police will continue to ask questions if you feel ill with COVID-19 symptoms. So that'll just be one series of questions that they please reschedule with the district court. And so they will be turned away at that point if they are feeling those symptoms. After September, that will be replaced with, the live screening will be replaced with signage. Masks will be provided for those who want one. However, after July 6th, they are asking that masks no longer be required to be worn in the building. Plexiglass within the courtrooms where the judges wish to have those removed will be removed. Plexiglass will remain in other areas such as the clerk's office and probation office. Jury room and administratives where requested will remain. Elevators, as you're aware, right now have a maximum capacity of 4 persons. That will come down. We will no longer have that maximum capacity. And we will remove signage where it states social distancing and wear your mask, and we will change that signage to encourage folks to get your vaccine. And so we will work with facilities, communications, and district court staff in the next 30 days to kind of transition that over. So be glad to answer any questions, and I might turn that over to Tom if you have anything you might want to add to that.
I might just add, Tanya and I were basically just listening to the conversation between the judge and the doctor as they were going back and forth about what they thought was reasonable and would be prudent. And then what Tanya just summarized is kind of what they came up with between the two of them. So I think it gives us some guidance on how to manage the building. I think after July the 4th, and that's on a Sunday, so July 5th is the holiday, and July 6th would be the first work day after all of this is removed. Then it throws it into the court of the arena, or of the commission on how you choose to operate the building after that time. But this was the judge's wishes going forward, so that's what we want to talk about today. And as Tanya mentioned, it's everything from the entry point to the elevators to the signage to how they're managing their individual courtrooms. And then all that's left for us to decide today also is how we'd like to move forward with public comment coming back into the building. And I think this gives us some guidance on how we could do that as well.
Okay, thank you. Commissioner Cruz.
Thank you. Do we have the ability to give vaccines here in our building? How are we encouraging folks to get vaccines, and how are we making it easy for them? We have a ton of people who come through this courthouse every single day. This idea just came to me. I don't know if it would be logistically possible. I don't know how much of a headache it would be, but do we still have Johnson & Johnson available? I mean, these are some ideas I think that maybe we could explore if we are going to start encouraging vaccines. Can we talk about that?
We can, and I might have Tim trade places with Tanya at the podium, but we're still running the library. We're running more and more remote clinics. I just on the news last night, I saw we were going to be at 2 schools running remote clinics. So I don't know of the capacity in this building, and I think we still have J&J too. True.
Good morning, Commissioners. Tim Kaufman, Deputy County Manager. We do have a little bit of J&J left. We don't anticipate right now that we'll receive any more, but that certainly hasn't stopped us from doing remote clinics elsewhere. We've given first doses of Pfizer and then encouraged people to get that second dose either. Right now when we're doing mobile clinics, we're scheduling a follow-up second dose for Pfizer, but we're also encouraging people to go anywhere they need to for that second dose. We'll certainly look at being able to isolate some space here where we'd be able to do some vaccines for folks, or just encourage them that while we've still got the 223 operating, it's a pretty easy, they finish their courthouse business and then we just go straight down to the clinic on.
Sure, I don't even know if it's feasible. I mean, I don't want to create a whole bunch of work if we don't have the need or demand for it, but there are a lot of people who come through this building every day, and if there was a way to make it very easy and simple for them, how could we do that?
Yeah, we'll talk to Tanya. The biggest issue anytime we do vaccines is the space for people to wait that 15 or 30 minutes,
Sure.
that observation space. So if we can find some decent observation space, we could certainly look at that.
Okay.
Commissioner Howell.
Thank you, Chairman. Just curiously, why July 6th? Or why September?
Just in the discussion between the two, I think they hit a comfortable zone there. First of all, I think the President of the United States has kind of identified July 4th as the tipping point for some of this movement going forward. But I think Dr. Mins and the judge were talking about giving vaccines a few more weeks, especially with kids, to pick up and for people to get vaccinated. I just felt like that was the middle ground that they hit that they agreed upon.
I guess anecdotally, again, I just don't see what's going to change between now and July 6th. That's 6 weeks out. Mm-hmm. We'll see a few more people getting vaccinated, no question, but our situation is green. I mean, we have good hospital status. Our numbers are trending nicely. I don't know what I would expect July 6th, or you mentioned also September as being 2 different thresholds. I don't know what data is being considered to make those decisions. I just don't understand that. But the other thing I made this comment the other day when we were talking about this, and that is that this is not just a courthouse. I mean, this is called the Sedgwick County Courthouse, but this is a place of business for the community to come and pay tax bills and pay tickets and they access the Register of Deeds and the county clerk, the DA's office. Those are all things that are not just court-related, and not to mention the communications and counselor's office and county commission. We have a lot of things in this building that, frankly, are not really under the, in my opinion, I guess maybe this is in my interpretation, but I don't think should be under the court's decision. But you mentioned, the very first thing you said today was the state Supreme Court said that we could have local control. I guess in terms of local control, does the judge and the courts have total control of this building, or do we have a voice in this discussion? And if we have a voice in this discussion, who's advocating on behalf of the people?
Well, the people can still come into the building. The question at hand is, when is the judge comfortable and his staff and his judge is comfortable taking the mandatory mask policy off of the court facility, and July 4th was the day that they came up with. So people can still come into the building, do all the business. It's a question of whether they put a mask on or not to do that.
So once again, I know that typically government has challenged trusting the people, but I'm going to say roughly 50%, maybe more of the people, maybe 60%, is on what math you want to use, but they are immune from this, and they are being told to conform to behavior standards and wearing masks when it has actually no impact on their personal immune status. And so we're actually asking to regulate and control people for things that don't really impact them personally. For those that are not vaccinated, I think, again, we have the option of suggesting that they wear a mask, and if they want to not wear a mask, I guess that's a choice they can make. But if someone out there doesn't want to wear a mask and they've not been vaccinated, and because I have been vaccinated, if they were in my presence, they're not going to hurt me because I'm immune. And I think that needs to be understood in this policy. So those that are causing, if you want to think of this as additional risk, they're making deliberate choices to not wear a mask and to not be vaccinated. That's the choice that they're making. In the meantime, those of us that have gone down this path of being vaccinated and have been wearing masks and have gone through this thing, we're continuing to be regulated and controlled at a point where it doesn't really impact my personal safety at this point. I think we need to move forward. And at that meeting with Dr. Mins, no offense, but somebody should have been there. Somebody should have been there, I think, to advocate for the other side. If we're going to create policy, someone that should be there, that I guess has a different perspective, so that at least the conversation could be represented by both viewpoints.
I think this is about partnership, partnering with the people in our building and understanding that we're almost there. It's not that much longer. We have a responsibility it's just like Dr. Min said a long time ago. We're almost done. We don't give up at halftime, right? We're in the third quarter now. Let's not give up. And I don't think it's a matter of controlling people. It's a matter of partnership with the other people who have this building. That's what it's about.
All right. Is there a way that the courts can operate under their rules? And then now that we've all been vaccinated pretty much on the third floor and open, can we somehow manage people to get to the court system under the court's rules, under the Supreme Court, the courts of the state of Kansas, and we somehow allow people to somehow get here on the elevators and attend meetings and address us in person, and we could still do distancing somewhat. We could have them wait in the other room and out in the hall and whatever. But has that been discussed by the court? What's her name that handles that? How we can manage that?
I don't think that the judge or Ellen would care at all what we do on the third floor. This is the protocol they asked for in consultation with Dr. Mins for all of the courtroom floors in this building.
Well, I know we've been saying for a while that the last commissioner, I guess you're on record as saying that we were waiting until him to get vaccinated and the couple weeks after, and I think we're at that point. My personal feeling is somehow we need to let the people be around this third floor, which is kind of more of the people's area. I'm reluctant to rule on the Treasury Department downstairs and the protocol that the security has to go through to determine who's potentially ill. I understand if they ask them still if they're ill or they don't feel well, then they call the court and say, hey, this juror has been excused and so there seems to be a process already working to help manage the courts. And then how do we, I'm just kind of in favor of allowing us to get back to a little bit of normalness here on the third floor with citizens to address us, and especially since I think everybody's been vaccinated. Communications team has, I think our front office has, and all your staff has in the attorney staff. So anyway, that's just my feeling. Commissioner Howell.
Thank you, Chairman. And I agree with your last comments. I think that the point I would make is they've had plenty of opportunity. How many vaccinations are going unfilled right now. We've reduced our hours at the old library because we don't have an interest from the public. They've reduced their interest in this. And how many opportunities have been there? I don't know if it's status somewhere. How many unfilled vaccine appointments have we had? But I think it's a lot. Hundreds, if not thousands, of unfilled vaccine appointments. And so people have had the opportunity. We've crossed that threshold. There's not people in this community that say, I don't feel safe, I want a vaccine, I can't get one, I'm waiting for my opportunity. No one can say that now. That was a month ago, okay? We are now in a different world. Everyone's had the opportunity, and that changes things. I want to ask two questions. I want a crisp answer, hopefully, because I think this is important for the people. I want to know, does the county commission have a voice in this decision about this building? And if we do, then who's making the choice? And if we don't, please clarify that. I want to know, does the policymakers of the county commission, county government, do we have a right to weigh in on this decision about how we're going to handle public into our public spaces here in this building? And if we have the right if we have a right to be heard, then who's making this decision? Is there a consensus here? I don't know if there is one. And I guess I'd like to know whether or not we have a right to advocate on behalf of the people. And if we don't, please clarify that. So I want to know who's responsible for making the decision.
You absolutely, Commissioner, have a right to weigh in. And I think we have, as Commissioner Cruz said, we're sharing a building with a court. We have other electeds. We have a district attorney, a sheriff, clerk, deeds, treasurer. We share the building with. Those are independent electeds as well. But for this floor, this space, your work area, absolutely can dictate how you want this floor managed. I would want to talk to the treasurer about the first floor.
Mr. Manager, as an executive of her office, I think she can set policy for her people and for her office. I'm not trying to say she doesn't have that authority. She does. Mm-hmm. I'm not going to question that. What I'm saying is, if she wants to set policy independently of the rest of this building, she has the right to do that. I don't want to step on her authority in any way, or the clerks, or the deeds, or the courts. But the rest of this building that falls under Sedgwick County government, I think someone has to have the right to make that decision. I don't know who else that would be besides the county commission. Ultimately, I think it's us.
It is the commission. I think that the easiest tack on this may be that we require masks in the building, and then on certain floors, put signage up that say that masks are not required. For example, out here in this lobby, if the commission decides as a group that we don't need masks on this floor anymore to go to your offices or go to this room where the people meet, we can signage that as such. But I think the easiest way for the courthouse police to handle the portal would be masks are still required in most areas of the building, just depending on where you go. When you step off the elevator, there'll be signage if you can take the masks off.
I think that's okay to do it that way. I think that's a reasonable, because you don't know what floor they're headed to, and if they don't have a mask coming into the building, they end up on a court-related floor, they may have a challenge then of how to get a mask all of a sudden when they come off the elevator. So I think that's reasonable. But I just think that, let me just preface my previous comments with one more point. That is, if someone out there feels vulnerable and at risk of having COVID because they've not received the vaccine or because they have a immune compromised system of some sort, they always have the choice of social distancing. They always have the choice of wearing a mask. And I support them in making those decisions. But their decisions and their situation shouldn't impact a free people all around them to protect that person necessarily. I think we have to understand that every person has opportunity and responsibility to mitigate these risks, and they have to be educated, and we have to trust them at some point. So I don't want anybody to be vulnerable to this and to suffer consequences of this. I don't want anybody to get harmed in the process. But we need to move forward as a people. This vaccine's out there, and I think that for us to allow them to come off the elevator, take that mask off because they're immune, that's good policy.
Okay, Commissioner, you're repeating yourself,
that's fine.
so go to Commissioner Lopez.
Thank you. Well, I think you've already answered part of my question because it was just going to be how we can do that realistically where some areas you have to have them and some you can't. But if you come in and just have to wear them, I mean, is it going to be up then to department on what they feel comfortable with, or what is it? I guess I just don't understand how we can do this as simply as possible where it's not so confusing to people, because I think keeping things simple is the easiest way to go. So I don't know the best way to really go about that. You know, I've said since the beginning, I want to follow the guidance of the CDC and their recommendations, and they say if you're vaccinated, you don't need to wear masks. So I would be fine with looking at this option and seeing how it makes the most sense, as long as it's as simple as possible for everyone, and then making sure that, you know, in the courts, that they are continuing to wear their mask if that's what they have decided, and we are all respectful of that. So I guess just however it can be done as easy as possible and whatever people are comfortable with. And I would like the signs that are recommending vaccines. I think that would be really important to have. And, you know, I don't know, though, I was going to ask about your comment. Are you saying for people not to wear masks, or to let everybody come back in? I guess I just wasn't sure on what you were saying.
Well, we don't know how to, if they're not vaccinated and don't want to be honest to say I'm not vaccinated and still don't want to wear a mask, then that's a problem that's there. But we've all been vaccinated, and so the responsibility is on that person. All of these offices in the rest of this building are operated by elected people, independently elected. So in my opinion, I don't think we have any jurisdiction on what to tell the courts how to operate their system, unless we want to get into the security and all that stuff. In my years here, we've never been involved in telling the courts how to operate, and same with Treasurer and the other independent elected places. So really, there's only a small part of this building, I believe, is kind of our venue, or our people, so to speak, the people's area. So it's just my feeling that I think it's time to get back to be consistent with the vaccination discussions we've been having, and that's where, if it involves people should be encouraged to wear masks if they haven't been vaccinated, but we have no idea. I guess we could ask anybody that addresses us, have you been vaccinated? And if they say yes, then fine.
I don't know if we're allowed to ask that, but I would be more comfortable if we set up maybe a limit on how many people can be in here at one time. If more people come, how we can do that, where not everybody's in this room all at once. That would make me feel a little bit more comfortable having some social distance still until maybe some of this time passes. But
Understood.
I'm going to really lean into whatever the departments feel is best for their department, the same way we're doing for businesses. Sure. Thank you.
Okay. And Commissioner Cruz.
Thank you. I just want to know what the best way to support our courthouse police would be. I think it kind of goes back to when we were talking about children and masking, and it was kindergarten. Was it age 5, age 4, age 6? And how do you know, who's supposed to wear them and who's not supposed to wear them? And so how do we support the one entry point that we have for the public, and how is that going to work? How are we going to support our courthouse police in managing this cumbersome?
Well, I'm listening to the dialogue and I'm thinking through it as we go, but clearly, I think the courthouse police would still do a verbal question of people coming in and continue that policy as long as anybody in this courthouse wants it done, judges or electeds. And then I would think the easiest way to manage it would be so everybody has to put a mask on, and when you get off on certain floors or go do certain business, you could take them off. And we would signage, for example, if the commission's comfortable signing this lobby area out here when they get off, then people would know when they got off on this floor, they could remove the masks and come in and address the commission.
Okay. All right. Yeah. Commissioner Dennis. Thank you.
Thank you, Mr. Chairman. I'm in favor of opening the commission up and the areas that we can control to an extent. And the reason I want to caveat, take me for example, I'm 74 years old, could not get the vaccine for quite a while. We were phasing it in over a period of time. Even at my age, I was not eligible for quite a while, and I ended up getting COVID. And as a result of that, had the COVID infusion, and I couldn't get vaccine for 90 days after that. So I'm not sure where all of the people are at on this cycle. As a matter of fact, Friday is going to be 2 weeks from my second vaccine. So I don't know how many people are younger than I am that couldn't get the vaccine, that ended up getting the COVID, that may have had to wait in order to get the vaccine. So I would love to see us open this facility up, especially our boardroom more. But I don't know. We can't ask people if they feel comfortable. We can't ask them if they've had the vaccine. So I think we're still going to have to do some kind of social distancing within our chambers and maybe some other portions where the public frequents as we move forward, because we don't know. And I can tell you that as of Friday is my final 2 weeks from my second vaccine. And I just don't know how many people that are younger than I am that were in the same condition. So I don't want to repeat myself, but I just don't think we can open up 100% all at once. To Commissioner Howell's comments that everybody's had an opportunity, I disagree with that. Not everybody's had an opportunity. I'm a prime example that we have not all had an opportunity to get the vaccine. So we've got to be cognizant of those folks that haven't. Thank you.
And I think keeping plexiglass here is still warranted and some kind of distancing, I feel, is probably warranted. So,
Sure.
okay. Do you think you can recircle with the police downstairs and reconfirm with the other elected floor officials, and we respect what they want to do?
Absolutely.
Yeah. Any other comments? Okay, I don't see any. So
Before we disband, what is the commission's will on allowing, I assume we will then allow people to publicly speak again, so, and
yeah, when's the next meeting? June 2nd?
well, we have a meeting,
June 2nd.
yeah, June.
June 2nd.
2nd, yeah.
Yeah.
A week from tomorrow.
Yeah.
Okay, to
Yeah.
allow public comment, and to
Yeah, I think so.
Commissioner Dennis's point, we'll still allow on our website, if people are uncomfortable coming in, they can still Zoom in, they can still phone call, and we'll continue
Right.
to offer those options. But if they choose to come in person, we would
Yeah.
allow that also.
And then, so they'll, I don't know right now, just say that they'll be subject to some protocol at security coming in
Right,
to get
okay.
here. And I don't know that we know exactly what that protocol is until we do with the security police, right? The courthouse police.
Well, as I'm understanding, they will still be questioned
Okay.
at the entry point and still be asked to wear a mask when they come in, but as they enter the
Okay.
floor, they will be
Okay.
told they can remove their mask.
Okay. All right, I think you're getting positive nods. Yeah.
Yeah, I'd just like to add to that. I'd like to ensure there's also opportunity for electronic public comment for our meetings as well. I think that's been a nice addition to
Yeah.
our, regardless of COVID, I think that's a good thing for us to do.
Right. Okay,
That's it.
sounds good. Mr. Papoon, you got a second afterwards? I need to see you real quick. Afterwards, if I see you. Thank you. All right, anybody else have anything? We have a fire station this afternoon, and we have a zoo on Thursday. Anything else in your district you want to brag about? Okay. All right, everybody. Have a great day, and we'll see you. Watch the fire. Is the fire thing going to be, Tony, is it going to be broadcast? Okay. And webcast. And then the zoo thing, I'm going to be out of town, but you all can represent, and it's quite exciting. So thank you, everybody, and we'll keep in touch.